Let's clear the air right away. You can't get HIV from kissing. It's a common misconception, but HIV, the virus that causes AIDS, is not transmitted through saliva. Hugging, shaking hands, sharing utensils, or using the same toilet seat won't give you HIV either. These are all forms of casual contact that don't pose a risk. HIV is a delicate virus that can't survive outside the human body for long. It needs specific fluids and modes of transmission to spread. Understanding how HIV is and is not transmitted is crucial to fighting stigma and supporting those living with the virus. HIV transmission occurs through specific bodily fluids: blood, semen, vaginal fluids, rectal fluids, and breast milk. These fluids carry the virus from one person to another, making it crucial to understand how transmission happens to prevent the spread of HIV. These fluids must come into contact with a mucous membrane, damaged tissue, or be directly injected into the bloodstream for infection to occur. Mucous membranes are found in various parts of the body, including the rectum, vagina, penis, and mouth. Damaged tissue can be a result of cuts, sores, or other injuries, providing an entry point for the virus. The primary modes of transmission are through unprotected sex, sharing needles, mother-to-child transmission, blood transfusions, and needle stick injuries. Understanding these modes is essential for taking preventive measures. Unprotected sex. Having vaginal or anal sex without a condom significantly increases the risk of HIV transmission. Condoms act as a barrier, preventing the exchange of bodily fluids that can carry the virus. It's important to use condoms consistently and correctly to reduce the risk. Sharing needles. Injecting drugs with shared needles is a highly risky behavior. When needles are shared, blood from an infected person can remain in the needle and be transferred to the next user. Using clean, sterile needles every time can prevent this mode of transmission. Mother-to-child transmission. HIV can be passed from mother to child during pregnancy, childbirth, or breastfeeding. However, with proper medical care and antiretroviral treatment, the risk of transmission can be significantly reduced. Pregnant women with HIV should work closely with their healthcare providers to manage their health and reduce the risk to their babies. Blood transfusions. Though rare today due to rigorous screening, HIV can be transmitted through infected blood transfusions. Blood banks and hospitals follow strict protocols to screen donated blood for HIV and other infectious diseases, making transfusions much safer than in the past. Needle stick injuries. Healthcare workers are at risk of needle stick injuries, which can transmit HIV if the needle was previously used on an infected person. Proper training, the use of safety devices, and following protocols can help minimize this risk. It's important for healthcare facilities to provide a safe working environment and for workers to adhere to safety guidelines to protect themselves and their patients. Let's dispel some common myths about HIV transmission. There are many misconceptions about how HIV is spread, and it's important to understand the facts to reduce unnecessary fear and stigma. You cannot contract HIV through everyday activities that involve no exchange of bodily fluids. Touching, casual physical contact like hugging, holding hands, or shaking hands is perfectly safe. These actions do not involve the exchange of bodily fluids, which is necessary for HIV transmission. Sharing food or utensils. HIV is not spread through saliva, so sharing utensils or eating food prepared by someone with HIV is not a risk. You can enjoy meals together without any concern of contracting the virus. Using the same bathroom toilet seats, bathroom surfaces, or sharing a bathroom with someone who has HIV does not pose any risk. The virus cannot survive long outside the human body, and it is not transmitted through skin contact with surfaces. Sneezing or coughing. HIV is not an airborne virus and cannot be spread through respiratory droplets. Unlike the flu or common cold, HIV requires direct access to your bloodstream to be transmitted. Insect bites. Mosquitoes and other insects cannot transmit HIV. The virus does not survive in insects, and they do not inject blood when they bite. Remember, HIV is not as easy to contract as some may think. Understanding the actual transmission methods can help alleviate unnecessary fears and promote a more informed and compassionate approach to those living with HIV. It requires direct contact with infected bodily fluids through specific activities. These include unprotected sexual contact, sharing needles, or from mother to child during childbirth or breastfeeding. By knowing the facts, we can better protect ourselves and support those affected by HIV. While oral sex carries a lower risk of HIV transmission compared to vaginal or anal sex, it's not risk-free. The risk is higher for the partner receiving oral sex. Factors that increase the risk during oral sex include sores or bleeding gums. Open sores in the mouth can provide an entry point for the virus. Genital sores. Sores on the genitals of the partner with HIV can increase the viral load in fluids. Ejaculation in the mouth. While the risk is still lower than vaginal or anal sex, coming into contact with semen increases the chances of transmission. Using condoms or dental dams during oral sex can significantly reduce the risk of HIV and other sexually transmitted infections. Section 5. Protecting yourself. PrEP, PEP, and U equals U. Thankfully, we have effective tools to prevent HIV transmission. PrEP, or pre-exposure prophylaxis, is a daily medication that can significantly reduce the risk of contracting HIV. It's highly effective for individuals at high risk of exposure. PEP, or post-exposure prophylaxis, is an emergency medication taken within 72 hours of potential HIV exposure. It can prevent infection if taken correctly. When someone living with HIV takes their medication consistently and achieves an undetectable viral load, they cannot transmit the virus sexually. This is known as U equals U, or undetectable equals untransmittable. U equals U is a powerful message of hope and a testament to the effectiveness of HIV treatment. Section 6. Occupational hazards and HIV. Healthcare workers and others in specific professions face occupational risks of HIV exposure. These risks primarily involve needle stick injuries or contact with infected blood. Hospitals and clinics have strict protocols to minimize these risks. Universal precautions involve treating all bodily fluids as potentially infectious. Sharp safety includes using safety-engineered needles and disposal containers to prevent needle stick injuries. Immediate access to post-exposure prophylaxis, or PEP, is provided for healthcare workers following potential exposure. These measures have significantly reduced the risk of occupational HIV transmission. Section 7. Co-infections, circumcision, and other HIV considerations. Understanding HIV involves more than just transmission. Here are some additional factors. People living with HIV are more susceptible to other infections like tuberculosis. Treating these co-infections is crucial for overall health. Male circumcision has been shown to reduce the risk of HIV acquisition in men. While rare, it's possible for someone living with HIV to become infected with a different strain, a situation known as superinfection. Additionally, some individuals have a natural resistance to certain strains of HIV, a phenomenon referred to as genetic resistance. Section 8. Living with HIV, pregnancy, aging, and the future of prevention. This section delves into the evolving landscape of living with HIV, focusing on key aspects such as pregnancy, aging, and the ongoing efforts in prevention and treatment. HIV is no longer a death sentence. With the advent of antiretroviral therapy, people diagnosed with HIV can now expect to live long, fulfilling lives. This transformation in the prognosis of HIV has been one of the most significant medical advancements of our time. People with HIV are living long, healthy lives thanks to advancements in treatment. Regular medication and consistent medical care have made it possible for individuals to manage the virus effectively, maintaining their health and well-being. This has allowed them to pursue their dreams, careers, and personal goals without the constant fear of the disease progressing. With proper medical care, women living with HIV can have healthy pregnancies and deliver HIV-negative babies. This is achieved through a combination of antiretroviral therapy during pregnancy, careful monitoring, and appropriate delivery methods. The success of these interventions has brought hope and joy to many families. As people with HIV live longer, addressing age-related health issues in the context of HIV becomes increasingly important. This includes managing chronic conditions such as cardiovascular disease, diabetes, and osteoporosis, which can be more prevalent in the aging HIV-positive population. Healthcare providers are now focusing on holistic care approaches to ensure that older adults with HIV can enjoy a high quality of life. Scientists are continuously working towards developing an HIV vaccine. This involves extensive research and clinical trials to ensure safety and efficacy. The development of a vaccine would be a monumental step in preventing new infections and ultimately controlling the spread of the virus. While a cure remains elusive, ongoing research offers hope for the future. Scientists are exploring various avenues, including gene therapy and immune modulation, to find a definitive cure. The dedication and perseverance of the scientific community keep the hope alive that one day, we will see an end to HIV. The fight against HIV requires a multi-pronged approach: comprehensive education, accessible prevention methods, effective treatment, and compassionate care. Public awareness campaigns play a crucial role in educating people about HIV transmission, prevention, and the importance of regular testing. By understanding the facts about HIV, we can reduce stigma, support those living with the virus, and ultimately end the epidemic. Community support and solidarity are essential in creating an environment where individuals feel safe and empowered to seek the care they need. Together, we can make a difference and move towards a future free of HIV